So we're just getting out all of our geek flags today and flying them high. So when you start really looking at this,
but just remind our listener, just because
Yes.
I'm familiar with it, let's just stop there for a moment, because what Robert Navio talks about, and we've explored this on several podcasts as well with mast cell, activation, all of that problem. But let's just go Robert Navio 101, what his message is.
Well, and I'll say his message as pertains to my work, because he has a very grand message and it's complex, but as pertains to the topic that we are discussing today, is that it looks at the stressors, right, of chronic conditions and the healing process, and how that affects particularly the mitochondria, which is the powerhouse of every cell in our body. And what happens, and it just so happens that trauma exposure, psychological trauma, is one of those major stressors to the mitochondria. And then we partner that with polyvagal theory, right? And then it gets really exciting, but we'll stick with one.
And we'll get onto that as well.
We'll get onto that. And so what we have is that the mitochondria become stressed, and then they become rigid. And as they become rigid and they start moving into what's known as mitochondrial dysfunction, then they cannot produce the energy that is needed for the organism under the best of circumstances, the organism being each of us, right? All of us as human beings, so we are subjected to this, and it can lead to a whole host of mitochondrial dysfunction-related chronic conditions. And so then we look at the healthcare provider who has an inordinate amount of trauma exposure. And so it complicates. So now what we have are the patients and clients, those in our care, are coming to us on what might be a traumatic circumstance or situation that they're navigating in their lives. And then they're being met by healthcare providers who have had the same individual trauma exposures, and then this whole layer of unavoidable trauma exposure that comes with our jobs, right? Comes with our profession. We suffer along with those in our care. And then there's this whole other, avoidable trauma exposure. And so if you think about that through the lens of the mitochondria that are trying to produce the energy that is required to not only just be a human, but to be a health provider, right, with the unavoidable trauma, and then be a health provider with the other layer, the avoidable, then the unavoidable. It's just I call it the trauma trifecta. And this is blowing out, for lack of a better word, the mitochondria. So for healthcare providers who are out there, nurses, physicians, dentistry folks, allied health professionals, if you are struggling to get off the couch on your days off, and maybe the best you can, and I have been here, the best I can do is, no, I can't go for the hike and the picnic in the woods because my mind is willing, but my body just can't. And I can grab the remote control in one hand and I can get my phone in the other for some takeout, and just, kind of be in this sort of what Porges would call the freeze state. It's this exhaustion that's I'm not just tired from work. Not the tired, I've had a busy work week and I don't feel up to it. This is the bone weary fatigue and exhaustion of I can't. And that is not a character flaw or a personality deficit. It is literally a function of the mitochondria not being able to produce the energy that is needed for the prolonged trauma exposure and traumatization. So that's kind of like how his work meets mine.